I think the work that Dr. Krantz does and the technology that she uses shows how willing we are to think out of the box and to customize care for each individual patient.
We take a very integrated approach to addiction. So the clinicians, all the physicians, we meet and discuss all the patients.
I've seen patients that have come in that have been suffering for a long time, and some of them come in with cognitive impairment.
We know the target organ is the brain. The brain is in control of everything that we think, say, and do. So to image the brain in addiction medicine gives you a lot of information about that particular patient. When you look at alcohol dementia, a patient that presents with significant cognitive decline from alcohol, the patient has frontal temporal deficits that are obvious, and the holes really represent decreased blood flow to that area. Frontal lobes, which is executive functioning, critical thinking, forward thinking, and impulse control. And this patient obviously had a really hard time not drinking. Then we started her treatment. So she received what the clinicians do with cognitive behavioral therapy, with the family restructuring program, with all the dialectical behavioral therapy. She received hyperbaric oxygen treatment to increase blood flow to the area. She received QEEG neurofeedback to help improve the neural pathways. And I rescanned her about a month and a half into that treatment, and her scans were, I mean, it's a picture sometimes is worth 1,000 words. You can see the change in blood flow. I mean, marked difference in blood flow. But also, more importantly probably, is the clinical outcome of the patient. She was able to do treatment work. She was able to actually get to core issues. I had a man that I've treated using SPECT scan, and the emotional area of the brain, the limbic system, was hot. And I said to him, is there something that you're struggling with and you're having a hard time dealing with? And he's like, why do you ask me that? And I said, because your brain is showing that there's a lot of activity in this area of the brain, and that's really your emotional sobriety kind of area. And he said to me, my brain shows that? And I said, yes. And he started crying, and I was like, and he had been sexually abused by his father for like 10 years and had told no one. So when he saw that it was real and that what he was feeling was real, and he saw it on his scan, I mean, then we were really able to target treatment and help him more.